Hello, I'm Dr. Carson from Baptist Health Family Clinic, and I want to take a few minutes to introduce a new program that we're piloting, and it's called Advanced Primary Care Management, or APCM for short. This is part of a larger initiative that's designed to enhance the care that we provide for our Medicare patients. Our clinic has been chosen by Baptist to test this program before it expands across the entire Baptist health system. And the goal is to ensure that we are providing high quality care that's comprehensive, and we're trying to expand the services that we are able to give to you. Many of you know that healthcare doesn't just happen during our clinic visits, but between appointments, our team spends a ton of time managing care, answering calls, reviewing test results, coordinating prescriptions, arranging referrals, and checking on your health just in general. So here's the deal with this new program. Basically, it allows us to be compensated for this additional work, and it ensures that we have the resources to maintain and expand our services. So this means that we can continue to offer benefits like 24/7 access to primary care, easy access to medical records through MyChart, televisits for your convenience, personalized care plans for managing your chronic conditions, and really just better follow-up care after your hospitalization or ER visit, and things like help from our in-house dietitian or our in-house pharmacist, who we often ask to call and check on our patients to make sure that their medications are working okay and they're not having any goofy side effects. So really the spirit of this program is it's designed to improve the quality of our care that we can give to you, not change it, but just make it better. Whether you choose to participate in this or not, your care here at Baptist Clinic is going to remain the same. Now, here's how the program works financially. If you have Medicare and at least one chronic condition, we can bill a small amount, about $15 per month, to help take care of you and use all of these resources. If you have two or more chronic conditions, the reimbursement is a little bit more. But if you're on Medicare and you have Medicaid, so we call that dual eligible, the program is totally free and you won't ever have any out-of-pocket expense. The key thing here when they asked us to pilot this program is that we really didn't like the idea of anyone having to pay out of pocket. And the feedback was that we don't expect people to pay out of pocket, but we can't guarantee that because Medicare hasn't really clarified to us how that's going to work. Now, I know this seems kind of goofy, and that's why this is a pilot program. We're trying to see how all this works. What I've been told is that we can examine this on a case-by-case basis, and if somebody gets charged and has to pay out of pocket, then we can review that with you again as a case-by-case basis. But our goal is that this will be something that is billed to your insurance in the background, and that's what I'm hoping for. So some of you might be wondering, why should I sign up for this if there might be an additional cost? And I totally get that. That was my question when this was all proposed to me. But the reality is primary care has really evolved, and more we're expected to provide care outside of the office visit. And this program helps us to do that. And it gives us the resources to continue to do that without placing additional financial strain on our clinic. So the funding from this program directly supports our ability to provide services, like I mentioned before, the dietitian, the pharmacist, and potentially adding things like a social worker or a counselor. We're trying to figure out what we would do with these funds to improve the quality of the clinic. So in short, by enrolling in this program, you're not just supporting your own health care, you're helping us to strengthen and expand the care that we can provide to everyone. The program, again, is entirely optional. And again, we're hoping that you won't have any out-of-pocket cost on this. But if you are one of the people that do get some sort of a small out-of-pocket deal sent to you, we want to know that, and you can cancel at any time. And so again, this is part of a pilot program. We're trying to get this figured out, how this will work. And we would really appreciate you signing up and helping us out to get this figured out for the whole health system.